Bienvenidos a un nuevo capítulo de Sin pelos en la lengua. En este episodio vamos a hacer las cosas un poquito diferentes. Debido a nuestras pacientes de habla inglesa, vamos a hacer este episodio en inglés y así también aprovechamos a presentar a nuestra jefa de enfermería, Laura Cris. Así que empezamos en inglés. Hello, welcome my friends. I'm Dr. Pano from Málaga, Marbella, Spain. This is a podcast about hair transplant and medical treatments for hair. This is the first of our podcasts in English, and we're here with our head nurse, Laura Cris, and we are going to talk about a few things, a few questions that normally people have, and try to solve directly from us, from the nurses and the doctors, about all the details that you need to know about hair transplant and hair treatments.
¿En qué consiste un trasplante capilar?
Okay, one of the first questions is what involves a hair transplant? So, what can you say about that?
Okay, so a hair transplant is basically moving your hair from one place to another. To cover an area of alopecia. It can be for men and women. It's a day surgery that is usually done within 6 to 8 hours depending on the person. It involves removing follicles from the back of your head, the donor area, and then moving them to the area that is not populated. Normally it's the front or the crown.
Yeah. What are the different techniques that exist?
Well, we have 3 different techniques. The FUT, or follicular unit transplantation, that it was a technique that we, under local anesthesia, we used to take a strip of skin from the back, stitch both sides together again, we remove the strip, we take the hairs out from that strip one by one, and we place them one by one in the recipient area. The most popular right now, there is the FUE technique, follicular unit excision, requires a round scalpel that cuts and extracts the unit, the follicular unit one by one, and the placement is again one by one like the first technique. And the third one is the body hair transplant technique, which is using hair from other parts rather than your scalp. So we can take them from the beard, normally from beard to beard, or
chest
to chest, or arm to arm. That's the best thing to do. Try not to mix them because it's going to look not very natural.
What are the different patients or the profile of the patients that usually come here?
Well, we have all type of patients. Normally we have androgenetic alopecia, but we also have other minor type of alopecias that require sometimes more treatment than surgery, and sometimes can be solved, especially with a hair transplant, forever, without any other treatments. So it's a little bit complex, but we have very cosmopolitan clientele or patients from all over the world because of the location. We are in Marbella, so we have people from Nordic countries, England, we have from America and Canada, we have from all Europe, we have from Morocco as well,
yeah.
and Arab countries like
Saudi Arabia is quite
Arabia,
popular.
correct, yes.
In the Middle East.
Yeah, we have a big number of patients from all over the world.
And what can you tell the patients about their expectations when they are going to do the surgery?
About the expectations, we try normally to keep the patient with low expectations. This is a surgery that we have more things to go wrong than things to go right. So we have to be very alert to minor details to make everything well. This means anesthesia, everybody needs a different type of anesthesia.
Yeah.
The bleeding is different in all the patients. We want to do a clean surgery. The punch has to be chosen for the type of hair of that patient, so you need to have several type of punches and several type of machines to use those punches. The way we're going to place the hair, we normally use pre-cut blades, which I think are the best ones because we can cut the blade to the exact size of the graft of the hair of that patient. And but we can use sapphire, and we can use other techniques of implantation like the implanter pen, and then the post-op as well is individualized to each patient. Some people have more tendency to have some swelling, or they have more tendency to have more accidents, so we try to keep them close to us and try to see them every day after the surgery, and to minimize the swelling and the discomfort.
There's a lot of small details. So with someone that has a lot of experience, and you have people that have a lot of knowledge, you're able to take care of each patient individually and give them all those small things that you need, like the incision that they need, the anesthesia, because it all adds up. Each pass makes a great hair transplant.
Bloque 2. El rol de la enfermería en nuestras prácticas. So now, there you go. We are going to talk before the surgery. What is your mission before starting the surgery with the patient?
Mission? What do you
What is it that you have to do?
Oh, what do we have to do before the surgery?
What do the nurses have to do before a hair transplant with the patient?
Well, with the patient, you have a lot of pre-op to do. You have to inform the patient a lot so that they're prepped for surgery. So you have two things. You have the physical side of it. So you have to prepare them, make sure that they are taking any medications that they need or don't need, make sure they understand what's going to happen on the day to get them ready. And then you have the other side, which is how they feel, how their worries, all those types of things. So you have to answer all the questions to them with confidence and knowledge. For example, some people ask a lot about pain. So we have to explain what the pain could be, that it's not that bad, try and give them a good explanation of how the day will be. That's the most common issue we have with the patient, is the anticipation of the day.
The medical part about the pre-op requires, of course, a good consultation and plan the surgery. We're always going to try to plan the surgeries along his life. So we're going to pre-medicate the patient, medically, orally, or PRPs or mesotherapy, so we can get the best hair possible by the day of the surgery. And that will help us indirectly as well to provide good grafts that can tolerate the aggression of the surgery, and they're going to grow faster and heal faster after the surgery. So that's important to pre-treat the patient. Is very interesting. Well, we can see a difference in results when we pre-treat the patients. And yes, of course, we have to manage all the questions that the patient has, as Laura said.
When you are in the surgery, what kind of tasks do the nurse have?
The main task of the nurse is to assist the doctor in theatre. So you're preparing everything for them, then you have to take care of the grafts, removing them, so extracting them.